Hi all, my name is Courtney Keegan Smith, and my presentation and subsequent paper are on the topics of overdose prevention centers and syringe service and exchange programs. To start, I would like to decipher between these two topics as they are different. These two quote-unquote topics and/or ideas are not one and the same as they both offer different resources and have slightly different goals or at least substantially arose from different goals. However, for this project, I will be discussing both as they are both based on the same policies and ultimately have the same goals, which is to reduce drug usage and to keep the community safer, typically by means of reducing drug overdoses and the transmission of infectious diseases such as HIV and hepatitis. Before I can dive straight into what syringe service and exchange programs and overdose prevention centers are, it is important to identify what the issues are and what the concern is to create policies such as these programs. So the big question is what's the problem? Simply put, there is a drug and drug overdose epidemic in the United States. Approximately 108,000 people died from drug-involved overdoses in the year 2022 in the United States. This has been a substantial and continuously rising statistic since the year 1999. One report from 2020 reported that there was a 63.8% increase in overdose deaths compared to 2016. This is only a 4-year difference. To continue to answer the question of what's the problem, we must further address another issue. Another issue that stems from the drug crisis in the United States is the spread of infectious diseases through shared needles, syringes, and other injection equipment. CDC research has found that 1 in 10 HIV diagnoses arise from IV drug users. However, HIV is not the only concern. Although HIV is mostly what the policy for syringe service and exchange programs focus on, hepatitis and other infectious diseases are also of concern. Now, before we can dive into the policy behind overdose prevention centers and syringe service and exchange programs, we must first address the history to understand the policy basis and the history behind both of these programs from the very start. To go back to the very start of overdose prevention programs and syringe service programs, also known as syringe exchange programs, we need to go back and visit the year 1988. San Francisco was at the top of the list at the time for drug issues that were a cause of the spread of HIV at the time. A small group had recognized the issue of the HIV epidemic that was going on, and they knew they needed to do something about it. This small but courageous group went against the law at the time and created the Prevention Point Program, which was an all volunteer, street based operation. The Prevention Point Program provided sterile supplies such as syringes, bleach, cotton, alcohol wipes, and anything else that can keep anything sanitary or clean for IV drug users. Further to the group's point of preventing the spread of infectious diseases, the group also offered things such as condoms and referrals to drug treatment programs. This group acted with great courage in not only recognizing the problem that was before them, but also in the way that they went about it. At the time, it was completely illegal in the state of California to possess syringes without a prescription. So essentially, this group created the Prevention Point program as an act of civil disobedience. The group continued to operate underground in this way for around 4 years, and this group even went as far as carrying these items in things like baby carriages to transport these items and necessary items where they needed to be able to pass them out. Even through the illegality of the program's circumstances, the program was able to partner with researchers to begin collecting much needed data to document the benefits of the Prevention Point program to further support themselves, which thankfully, eventually, they did gain some traction. Continue on to the history of the syringe service and exchange programs, we need to turn our attention towards the city of San Francisco. At the time, the mayor of the city of San Francisco, Mayor Frank Jordan, who is pictured on this slide, declared a public health emergency because of the circumstances of the transmission of infectious diseases through IV drug use in 1992, and even went as far as to give the Prevention Point program almost $150,000 towards their efforts, which would be upwards of around $300,000 in today's money. This decision at the time by Mayor Frank Jordan was not politically favored by any means, and was frankly one heck of a statement in the efforts to address the issue of not only infectious disease prevention, but also drug use. Even looking at today's society, there are still many areas where it is illegal to distribute sterile needles or syringes, but San Francisco was definitely a pioneer in the efforts for clean and safe syringe and other injectable equipment access. With that being said, the Prevention Point program was truly the start of what we know now as syringe service programs or syringe exchange programs in the United States, and most likely can even tip its hat for the efforts behind the start of the policy or issues and ideas behind overdose prevention centers. Although it should be noted that the first recognized syringe service and exchange program was established in 1988 in Tacoma, Washington, and had longishly been used in other countries around the world before the United States had even thought to begin using them. Now, to turn our attention to overdose prevention centers. The United States first opened its first overdose prevention center in New York City in 2021. Although, much like the syringe service and exchange programs, they were already widely being used throughout the world before they had even been thought to be established in the United States. It was first announced that there would be an overdose prevention center in the United States when the state of New York released a statement saying overdose prevention center services offer safe, clean places where people who use drugs can access clinical care and other services. The mayor of New York City at the time, Bill de Blasio, in conjunction with the health department, commenced this movement for overdose prevention centers in New York City, which is now being spread to the states of Rhode Island and Minnesota. So, although overdose prevention centers have not really taken off yet, I think it could be safe to assume that it will move quickly, much like syringe service programs have, given the history and how much it's needed. Overdose prevention centers were thought of as a solution for the staggering number of drug overdoses that were occurring in New York City. The statistics came from 2022 when there was an all-time high of overdoses in New York City. Over 20,000 people succumbed to overdoses in 2020 in the city of New York, which is a large majority of the 90,000 fatal overdoses that occurred across the nation during the year of 2020. It was also the highest number of reported fatal overdoses in New York City since the year 2000. So, although the history of overdose prevention centers are not as groundbreaking or illegal as syringe service and exchange programs, New York City is truly the pioneer for what we can imagine will become multiple centers throughout the United States, which is shown as centers are opening in more states, such as Rhode Island and Minnesota. Now that we have addressed the history behind overdose prevention centers and syringe service and exchange programs, it is important to highlight what these programs really are including the purposes of the programs as well as what they offer or provide. We'll start out with syringe service and exchange programs. So, syringe service and exchange programs provide comprehensive harm reduction services by providing sterile needles, syringes, and other injection items or injection equipment, as well as safety disposal containers for that equipment. Further, syringe exchange service and exchange programs have expanded from their start of only providing sterile injection equipment to also provide infectious disease testing, such as testing for AIDS, HIV, STIs, hepatitis. These programs also provide information and resources for treatment, provide overdose prevention and education. They provide information for substance use disorder treatments, medical providers, social services, and infectious disease education, which truly is what started this program or this policy. Do you kind of see now why syringe service programs and overdose prevention centers are so easily grouped together? Although the start and thought of these programs were for very different reasons, one being to address the issue of infectious disease transmission in light of HIV outbreaks, and the other one was strictly for overdose prevention in light of an overdose epidemic. Both programs tend to provide the same resources for those who use their programs, as I will further explain in the next few slides. Now that I have covered what syringe service and exchange programs do and what resources they provide, it's important to highlight the purpose of the syringe service and exchange programs, and the CDC best stated it. The CDC states the purpose of these programs by saying syringe service and exchange programs are community prevention programs that provide a range of services that prevent the spread of disease and protect communities by helping those with use disorders get the support they need while preventing fatal overdoses and reducing the impact of drug use on the community. Now to turn over to overdose prevention centers, which will hopefully further help you understand why these two programs should be more grouped together than not. So the purpose of overdose prevention centers are for them to be supervised consumption rooms, also known as safe injection sites, for which the ultimate goal is for harm reduction in the midst of a drug overdose crisis that is gripping the nation and most large cities in the United States. The Drug Policy Alliance stated that overdose prevention centers are designed to reduce the potential risks of drug use, including overdoses and unwanted public use. These centers provide trained staff who, in turn, provide sterile injection supplies, much like syringe service and exchange programs. But overdose prevention centers also provide intervention when necessary in the event of an overdose, as well as connecting individuals at the center with addiction and social support services, again, much like syringe service and exchange programs. But to give the short and sweet answer to the policy basis of overdose prevention centers and syringe service exchange programs, they were created to address not only the drug epidemic and the unprecedented rates of fatal drug overdoses, but also to address infectious disease transmissions that come along with the use of IV drug usage, all while still providing resources for treatment and social services for those who seek out these programs. So now that we have covered the history and the policy basis and what overdose prevention centers are and what syringe service and exchange programs are, we can now kind of move into where these programs stand currently, how they're doing, any study statistics, and that kind of stuff. So again, starting with syringe service and exchange programs. Today, there are currently over 300 syringe service and exchange programs across the United States. However, it is still noticeable that as of last year, 2023, there were still 6 states that did not have any active syringe service or exchange programs. These include Alabama, Kansas, Mississippi, Nebraska, South Dakota, and Wyoming. And also notable is that in some of these states, including Alabama and Nebraska, syringe service and exchange programs are actually illegal or not legally authorized. So, now for some statistics and data on how well syringe service and exchange programs are doing. Between the years of 2015 and 2018, there was a study done on the amount of centers or established or new centers being opened, as well as the amount of syringes that were purchased by these centers per year. The study found that there was an increase in the amount of centers from 2015 to 2018. In 2015, there was 141 established centers, and this increased to 292 in 2018. However, as we know, and as I previously mentioned, there are over 300 active syringe service and exchange programs throughout the United States. So, regardless of how fast these centers are being established, which obviously not being established as frequently now, but there still is an upward trend. This study also found that these centers purchased over double the amount of syringes. So in 2015, these centers um, bought 42 million syringes that year, and this increased to 88 million in the year 2018. So although there's not this huge uprise of centers being established, there's definitely an uprise in their use within the community. Another study used administrative data sets from syringe exchange service programs to estimate the effects of recently opened syringe service and exchange centers. The study found that the opening of a center in the area decreases HIV rates by almost 20%. To continue discussing syringe service and exchange program data, as another study stated, the diagnosis of HIV among IV drug users has increased at all-time high levels during the time of their research, which was from 2014 to 2018, which is the biggest quote unquote outbreak in over 2 decades. The study focused on these trends because of the social and communal issues of the HIV epidemic. The study further highlighted how syringe service and exchange centers are cost effective, safe, and highly effective at reducing HIV transmission in the IV drug user community. This study also highlighted that syringe service and exchange programs are a key player and play a key role in ending the HIV epidemic because they prevent, diagnose, treat, and respond. Syringe service and exchange centers have been at the forefront of providing clean supplies to prevent the transmission of HIV. And this is done by doing screenings for infectious diseases such as HIV, AIDS, hepatitis. They treat IV drug use complications, as well as provide resources for those infected by conditions such as HIV, and they give information to those in centers or that come to their programs with for drug treatment options and social service options. And finally, they also respond to any urgent issues such as drug overdoses and any other health issues that are typically common for IV drug usage. The study even goes as far as to say that based on the research and statistics of syringe service and exchange programs, they have the largest impact on HIV prevention because they combine access to medication for substance use disorders as well as for infectious diseases such as AIDS and HIV. And this is also on top of just providing clean supplies to begin with. This study, in doing a cross analysis of other research, found that there was an estimated 58% reduction in HIV among IV drug users if they attended a syringe service and exchange program center compared to those who did not use program centers. As to not overdo the boring part of this presentation or any presentation, I will not load on one study after another, even though I wish I could, because the data and statistics are truly fascinating. I do want to mention this last study that I'm going to mention because I just think it really captures how effective syringe service and exchange programs are. So, in this last study, it's a snapshot from the year of 2020, which again is not a super current study, but it really does give a good snapshot of the effectiveness of syringe service and exchange programs. So this study was done to show the effects of inactive, proactive, and reactive implementation of syringe service and exchange programs in a county in Indiana. So the study showed that in the absence of a syringe service and exchange program, there was a little over a 12% incidence rate of HIV among IV drug users. But if a syringe service and exchange program was established proactively in an area, then the infection and incidence rate of the rates of HIV among IV drug users decreased by a whopping 90.3%. And that's quite a large statistic. And then somewhere in the middle falls if a syringe service and exchange program was reactively implemented. So this study implemented a center about 10 months after the first HIV transmission in the area was recorded and then reported. But even then, there was still a 60.8% decrease in HIV infections and incident rates. And then, moreover, just to top off this study also reported finding that the incident rate of HIV among those in the area who are not IV drug users also decreased. So overall, if nothing is done, there's still an incidence rate. If something is proactively done, if they do it before it's a problem, it decreases substantially. The statistics in this study just go to show that. And then if you can't do that, you got to meet in the middle and do a reactive implementation of, okay, it's happening, we need to address it. There's still a decent decrease in the incident and infection rates, as shown by the 60.8% decrease. So, overall, to keep it a little short and sweet as a quick wrap up, syringe service and exchange programs had an ultimate goal, and it was to address the HIV epidemic that was sweeping across the nation and has ended up repeating itself in the 2010s. There has been an increase in the usage of syringe service and exchange program sites, which is shown by over double the amount of supplies being purchased by these sites, even if they're not even nearly double the amount of established sites within the same time frame. And most importantly, studies are indicating that not only because of the clean supplies being supplied by syringe service and exchange program sites, but also because of the treatment and education options offered, there has been a drastic decrease in the prevalence of HIV transmissions for those who utilize these syringe service and exchange programs, especially when in comparison to those who don't use these programs. Now, to again turn our focus over to how overdose prevention centers are doing today. As stated by the National Institute on Drug Abuse, there has not been any fatal overdoses while at an overdose prevention site in at all in the world, in any that have operated in at least the last 20 years. More specifically, it was found that there have been zero fatal overdoses in any of the United States operated overdose prevention centers between 2014 and minimally at least until the year 2021. It was also found by the National Institute on Drug Abuse that research has indicated that there is a reduction in public drug usage, all while still not increasing crime. Additionally, research indicates that overdose prevention centers lower the demand on healthcare facilities and emergency response teams. And finally, overdose prevention centers are associated positively with an increase in access to substance use disorder treatments. To continue pulling on the research I was just referencing, that same research further found that in neighborhoods surrounding an overdose prevention center, there is a reduction in public drug consumption. There's a reduction of the litter of drug consumption equipment, and also there's been found to be a reduction in crime. Further research on the use of overdose prevention centers have found that they are in fact being utilized. Mind you, overdose prevention centers really have only been open minimally at around for two-ish years, since late 2021. I believe it was November of 2021. One study found that overdose prevention centers were used in New York City alone 5,975 times between the opening of them on November 30th of 2021, and that was until January 31st of 2022. This is an outstanding utilization for only roughly a 2-month span at the time of their opening. Also during this time frame, staff responded to 125 overdoses, and again to mention there has yet to be a fatal overdose recorded at an overdose prevention center, at least around the last 20-ish years. It should also be noted that there really has not been enough research done on overdose prevention centers, at least in the United States, and also on their effects, most likely because they're so new to the United States. Again, they've only been open since late of 2021, so it's only been open for about 2.5 years. So there really hasn't been enough time for researchers to gather data and to publish that data. However, we should expect that there will be a lot of research that will be published in the next few upcoming years that outline and highlight the success of these overdose prevention centers, especially amid the opioid crisis that is in the United States. Again, to try to be short and sweet to the point, overdose prevention centers are successful as they stand now. And this is largely because there has been no reported fatal overdoses thus far in the United States. And further, even though research only shows such a small snapshot of time, overdose prevention centers are being used and they're being used a lot. So overall, syringe service and exchange centers are currently successful in addressing the policy issue at hand for which the purpose they were created, which was to address the HIV and other infectious diseases that were and are causing national health emergencies across the United States. And further, overdose prevention centers are also currently successful thus far, as any research published so far can tell, because they're being used and there haven't been any fatal overdoses, which is the whole reason behind policy and purpose of overdose prevention centers. So, simply said, there is an overdose epidemic taking hold of the United States as drugs and opioids are being used at far greater rates than we've seen in the past. And overdose prevention centers are really working towards eliminating those issues. Now that I have covered some of the best points of syringe service and exchange programs, as well as the best points of overdose prevention centers, it wouldn't be a true analysis of these programs and policies if I didn't discuss the negatives of these programs as well. So, to begin the discussion of negative effects or unintended consequences of the syringe service and exchange programs, the same study that found that the opening of new syringe services and exchange centers decreases HIV rates by almost 20% had also found that the opening of these centers increased the rates of opioid related mortality by roughly 2 to 3%, but it also causes higher emergency room visits and higher inpatient stays for drug related complications. And often these effects from this study were most noted in rural and high poverty areas. The National Library of Medicine at the National Center for Biotechnology Information also did a research study. And in that research study that they found that there were four unintended results or negative effects of syringe service and exchange programs. So that study had found first and foremost that there was an increase in drug use by program participants. Second, there was an increase in new initiates to IV drug use. Third, there is still drug use in the community in general. There was no elimination or decrease in drug use. And finally, there was an increase in the number of contaminated needles being discarded throughout the community. To reshift our focus back to overdose prevention centers and their negative effects and unintended consequences. It's kind of hard to establish these because, as I noted earlier, there has yet to be much publicized research on the statistics and effects of overdose prevention centers in the United States because they still are so new. However, I did really want to pull on a study from Canada. And in this study, they were tracking 25 established overdose prevention centers. And this research indicated that although there was a reduction in paramedic response necessity and emergency room visits, there was not a reduction in monthly hospitalizations. And most notably, there was not a reduction in mortality rates. So this research is contradictory to what has been published so far in the United States and also contradicts a lot of research that's been published in other countries, especially the statistics of there still not being any fatal overdoses, again, within at least the last 20 years in an overdose center. But I think it's important to highlight because it could be a trend that we also start to see in the United States once research becomes more available and becomes publicized. But I also must note that not all studies are so outright about any of the negative effects or unintended consequences of programs, such as the syringe service and exchange programs and overdose prevention centers. There are very few and far between studies who will outright come forth with, any negative effects that they did find, and mostly usually just focuses on the positive, at least from what I could find. As I hope this presentation has explained thoroughly thus far, there has been a rising issue that has continued in the IV drug user community, namely the incident rates of infectious diseases such as HIV and hepatitis, but also the incident rates of fatal overdoses. In response, policies were put into place by states and the federal government in the form of syringe service and exchange programs and overdose prevention centers. So now it's time to discuss a little bit further about the policy and policy issues that have arose throughout the time of these programs and the political issues that arose in even creating these policies and these programs. As usual, I will start by discussing syringe service and exchange programs. So, syringe service and exchange programs have long been controversial as a public health strategy in the United States. In 2014, syringe service and exchange programs were actually completely banned, and the federal government actually prohibited funding for these programs. However, the political stance did shift once there was an HIV outbreak and the HIV incidence rate started to rise. The federal government pretty quickly changed its position on syringe service and exchange programs and began allocating federal funding to the program. But as I will discuss in the next few slides, it was not an easy road and it had a lot of back and forth, and there was a lot of political switch up between both parties. To return to the federal ban on syringe service and exchange program, beginning with the year 1988 with the conservative North Carolina Senator Jesse Helms. He posed syringe service and exchange programs as supporting, and not only supporting, but also endorsing drug abuse, which in turn then led to the complete prohibition of federal funds being allocated to this program. So the lift of the ban of funding for the syringe service and exchange programs came during the Clinton administration when Congress was given the opportunity to overturn the previous ban in light of the positive, beneficial, and efficient research coming out about the syringe service and exchange programs. The ban was officially lifted via a press conference in 1998 by Donna Shalala, who was at the time the head of the Department of Health and Human Services, but it was met with a lot of pushback from the Republican Party. Namely, the Republican Representative Denny Hastert from Illinois denounced the movement and followed the original reasoning from the original prohibition that it was simply supporting drug addicts in continuing their drug habit and was not actually a true use or harm reduction strategy. So, again, due to the pushback from the Republican Party, the ban on federal funds being allocated or used for the syringe service and exchange program ended up continuing through the George W. Bush administration. But there was a change on the rise as former President Barack Obama capitalized and promised during his campaigning for his presidency to remove the ban. And the ban was subsequently lifted in 2010. However, once Republicans again took control, the Democratic Party was yet again left retreating, and the lift of the prohibition for funding, at least funding being allocated, to the syringe service and exchange program was reinstated. So, as I previously stated, the ban was short-lived when the HIV outbreaks began, and it was specifically in Indiana, where there was a huge HIV outbreak. Representative Hal Rogers, Senator Mitch McConnell, and Senator Shelley Moore Capito, all from the Republican Party, then made a substantial push towards lifting the ban once again in support of allocating federal funds to the syringe service and exchange programs, which then went on to eventually be passed in December of 2015. But it was only a partial repeal and it wasn't a full lift on the previous prohibition for any funding going towards this program. So the federal use to pay for items distributed at syringe service and exchange programs was still completely prohibited. But instead, the funding allowed for funding towards personnel, vehicles, gas, rent, and really any other operational needs. The funding just couldn't be used for any of the injection equipment that was being distributed by these centers. Now, to again shift to the political and policy changes for overdose prevention centers. The path was not so back and forth and clear cut for overdose prevention centers as they were for syringe service and exchange programs. According to the Cato Institute, this is how overdose prevention centers came to life and also the political stances behind it. So first, other areas of the world, such as Europe, began operating overdose prevention centers in the mid 1980s, which then expanded to Canada, Mexico, and Australia because they were still considered illegal in the United States during the mid 1980s. But then overdose prevention centers popped up underground in the United States and were at least known of in Seattle as of 2014, which then led to states kind of picking up support for overdose prevention centers, even though it was in complete opposition to what at the time was federal law prohibiting these centers. But then we turn to the circumstance of it turning into the light of the rising drug overdoses in the United States. United States policymakers became increasingly concerned with harm reduction strategies, such as the syringe service and exchange programs that had been successful in the United States. So during the time period between 1980 and 2014, overdose prevention centers began expanding even more to other countries around the world. In addition to other countries investing themselves into overdose prevention centers, the data and research that was being published from the underground overdose prevention centers in Seattle specifically were quite groundbreaking in the political field. So there was pushback from the federal government still, such as an example from Philadelphia. Philadelphia had approved a privately funded overdose prevention center, and the Department of Justice ended up stepping in and threatening to basically arrest everyone involved. And that kind of put the end to that, and that center actually never ended up being opened. However, in 2021, the Democratic Rhode Island Governor John McKee ended up enacting legislation to privately fund an overdose prevention center. And then Mayor Bill de Blasio of New York City, as I had previously mentioned earlier in this presentation, also then took on the opportunity and the opening to then open nonprofit overdose prevention centers in New York City. So at the current moment, there is still pushback for overdose prevention centers. Overdose prevention centers are still technically federally prohibited, but there hasn't been any action taken against the ones that have already been established, such as in New York City. There are three opened, and in Rhode Island, in which there's one open. But there's also been some outspoken disapproval from other states, such as from California. The governor, Gavin Newsom, vetoed a bill that would have created overdose prevention centers in San Francisco, Oakland, and Los Angeles. However, because he vetoed that bill, those pilot centers never were opened. And again, it was very outspoken that there was a disapproval for them. So, short and sweet overall, syringe service and exchange programs have gone through a lot of political back and forth between both parties, whether they were switching sides or fighting against one another. But federal funding ended up being eventually allowed, but only for necessities that contributed to the ongoing success of these programs through operational needs, and not so much for the injection equipment that is being distributed. Overdose prevention centers, however, have not been given the same grace by the federal government and are still not federally allowed or federally funded, but there's also no current action being taken to stop them from operating. So the issue is now to more or less get other states on board with the program and hope that it follows in the same track as the Syringe Service and Exchange Program. So now that I have discussed the Syringe Service and Exchange Program and the Overdose Prevention Centers pretty in depth, the improvements and needs of these policies need to be highlighted. However, they are something that are kind of joint and can be grouped together. So I will again reiterate that there are two different policies at play here in this presentation. And to remind everyone, the syringe service and exchange programs were specifically created to focus on infectious diseases such as HIV, prevention, and the overdose prevention centers, which were focused on the overdose epidemic striking the United States. However, if you haven't noticed, these two topics and policies are almost one and the same when you truly think about what they both have to offer. Both programs offer sterile injection supplies, medical personnel and staff, treatment facilitation, most importantly. However, these two policies are looked at so oppositely, assumingly because their start and quote unquote purposes are different. One was for infectious diseases and another one was for overdoses. But to break it down, both programs are so similar, yet one is federally supported and the other is federally prohibited. And while it may make sense to an extent given the true differences in the purposes from which they both arise from, they do kind of arise out of the same thing, and it's from IV drug usage or just drug usage overall. And with that being said, a combination of both the services offered at overdose prevention centers and syringe service exchange programs seem to be pretty well fitting, specifically for overdose prevention centers to be in addition to syringe service and exchange programs. And not only would it be well fitting, it's much needed, and I think it's also a pretty well justified improvement to both programs. I mean, to break it down, one already has support, and both programs are at least starting to be backed by research to show their effectiveness. So, in turn, it would save time, money, resources, and would likely garner far more necessary support than trying to keep both of these programs completely separate from one another. So, short and sweet, the improvements and needs of both programs and their policies go very hand in hand. So, why fight it instead of just put them together? It may have seemed like a lot of information and justifiably so because it was, but it's time for a little bit of a wrap up and my two biggest key takeaways from researching and learning more about these policies. So, there are two major things that I learned about these programs and their policies, or at least that I learned from them. But I'm going to incorporate it into what these policies are and the things I've learned about these policies and their history and studies and all that good stuff. So, for starters, one thing is certain, it is hard to form a policy until things get real. So, returning back to the history and the political issues that arose for both the syringe service and exchange program, as well as the overdose prevention centers, there was no easy start for either program. Instead, there absolutely had to be an issue that couldn't be ignored, at least anymore. And thankfully, there were few people, um, even if it was a small group, that were willing to take this giant leap of faith, and it's more like courage if you ask me, to take matters into their own hands and to get the research and data to also back up their position. So to pull on my previous examples, there was so much back and forth for funding and around the illegality of the syringe service and exchange programs. And it took a small group of people to really start it and to gather the data and support. And even then, it still took decades to finally get the support from the federal government. And it was only after there was HIV outbreaks. And further, for overdose prevention centers, they are still prohibited by the federal government. But it took a few politicians to enact them anyway for the greater good, which have, again, thus far been successful in the United States, at least from the data that's been published thus far. But it's no surprise that the United States is behind the curve of the world who have been, using these overdose prevention centers for harm reduction for quite a while. And then, secondly, sometimes taking a step back could be for the greater good, at least in forming policies. So, to return back to what I believe are improvements and needs of both of these programs is honestly just to combine forces. So, when two policies, although for the initial start of different purposes, intertwine and essentially do the same thing or provide the same services, or at least along the same lines of the same thing and for the same purposes overall, which in this case of these policies would be to intervene on IV drug use, whether it's for the transmission of infectious diseases or for overdoses. It was and is truly staggering to see how resistant the political world is to one and not the other, especially given that one is established and supported with success, while another is prohibited but also quite successful as it stands today. So, to further the point, instead of fighting for two separate policies and programs at all, why wouldn't the rational thought to be to expand one policy that is already established and supported and to expand its goal or to make it even just a little more broad, such as for all the protection and prevention of IV drug usage or transmission of diseases and overdoses? But again, it all ties into one big thing: IV drug usage and its effects on the community, whether it's safety for disease transmission or for overdoses. So that concludes my presentation, and thank you for watching.